Hi, I'm Dr. Gokul from Dental Implants Veneers. Thanks for joining me today. Today I want to briefly discuss the options that you have available if you've lost one or more teeth. Let's get straight into it. Okay, option number 1, do nothing. Option number 2, a removable denture. Option number 3, a fixed dental bridge. Option number 4, something that's implant retained. So option number 1, sometimes it is okay to leave a gap, especially if it's at the very far back. And your wisdom tooth, which is also known as the third molar or the number 8, as well as the one just in front of it, known as the second molar or the number 7. When you lose these teeth, we don't usually replace them. Coming forward now, the third last tooth from the back is called your first molar, also known as the number 6 tooth. All teeth from the number 6 forwards are more important, and usually these are better replaced. But it is your choice to leave a gap if you wish. But remember that if you choose to leave a gap, there are consequences. Firstly, when a tooth is removed, you are going to get some bone loss. This is not unusual. It is perfectly normal. The bone that exists around the tooth is there to support the tooth. And when the tooth is gone, the bone goes. And this is perfectly normal. The vast majority of this shrinkage or resorption, as it's known, takes place in the first several months, but it does carry on slowly, getting less and less as time goes by. But when this bone loss happens, the teeth on either side of this new gap are affected as well, because they have lost some bone as well. The bone that was between them has now shrunk, and so these two teeth lose some support. And what you may notice is these two teeth on either side of the gap tend to drift into the gap, so you end up with gaps on either side. And additionally, because the gum shrinks with the bone, you find that these two teeth on the other side of the gap also lose a bit of gum around them, so they can become a bit more sensitive. In addition, the tooth on the opposite side of the gap tends to over-erupt. Teeth have this natural force in them that makes them want to carry on growing out of the bone. This is normal, and they eventually do stop because they hit an opponent, and that's how teeth are. But when you lose a tooth, the tooth on the opposite side starts to grow again. It'll only grow as far as there's space enough for it to grow, but it can over-erupt. And of course, there are consequences of its over-eruption. For one thing, that tooth will experience some gum recession because it's coming out of the gum, and so it may become sensitive. And the teeth on either side of the opposite tooth may also tend to want to drift in to fill in that gap. So there are a lot of consequences when you lose a tooth that we have to keep in mind. But it is an option. Option number 2 is something that most people know about, and this is a removable denture. A denture, by definition, is removable. You get different kinds of dentures made from different materials, most commonly acrylic or plastic dentures. But you also get something that's made with a metal or chrome base that's coated in plastic. And finally, you also get something that's made from a flexible material. These are all options, but they are all removable. The main advantage of a denture is probably the cost. Dentures do tend to be cheaper than the alternative options. And also, they tend to be slightly less invasive in their construction. I say less invasive, not completely non-invasive, because even for a denture, you do need impressions. Sometimes you need a bit of tooth cutting in order to make the denture fit better, or sometimes you have these little attachments on dentures that have to seat onto the teeth to give them better support. So a denture is an option. The main disadvantages of a denture are, of course, they are removable, so you do have to take them out every day. You take them out to sleep, you take them out when you clean your teeth and when you clean your denture. Some people do sleep with their dentures, but it's not ideal because your mouth needs a rest. A denture can sometimes be very difficult to wear. Some people just cannot cope. Some people do very well, but some people just cannot cope. It varies. It varies, but it is an option. Not the best option, but it is an option. Option number 3 is a dental bridge. A bridge, by definition, is something that's fixed in your mouth. How this works is, when you have a gap, you look at the teeth on either side of the gap, and provided they are healthy enough, strong enough, you could use them to support a bridge that bridges the gap. What you do is shave these teeth down on either side of the gap. Unfortunately, we are grinding away healthy tooth structure in order to make crowns or caps that sit on top of these adjacent teeth, and the false tooth in between sits between them. So you have if you're missing one tooth, you could have a 3-unit bridge with 3 crowns that are attached to each other. The 2 crowns sit on the supporting abutment teeth, and the missing tooth has a crown in the middle. Unfortunately, you do have to shave down healthy tooth structure, which means you are damaging healthy teeth, and you are to an extent reducing their lifespan. Everything has a limited life, and eventually when this bridge goes, you're not only going to have 1 gap, you will have 3 gaps. Now, these dental bridges used to be the best option because it gave a patient something fixed, not having to wear a removable denture. But there are better options than that these days. But a bridge is still a very common option. It can still last a reasonable time, and for some people it is a good option. There is another kind of bridge called a Maryland bridge. It's a different design. With a Maryland bridge, you don't have to grind away so much of tooth from the adjacent teeth. You either do minimal grinding or none at all. Instead, this bridge just has your middle crown where the tooth's missing, and on either side it has these little wings, and these wings are cemented onto the back of the adjacent teeth. So it's very nice in that it's so non-invasive or minimally invasive. Unfortunately, because it's such a small surface area that it's bonding to, it tends to have a weak bond. And the main problem with this kind of design is they do tend to debond sometimes. So your bridge, your Maryland bridge, can fall off every now and then, which means you're going to go have to see your dentist to have it re-cemented. I'm personally not a big fan of this kind of bridge as a permanent option. I do like them for temporaries though, because frankly we can remove them and replace them as we like. But as a permanent option, not so good. A fixed conventional bridge, yes, it's much stronger, but very destructive. And remember that with this bridge, it does make it a bit harder for you to clean. And it is vitally important that you are cleaning underneath, under your bridge, because those 2 supporting teeth are more at risk of decay because of the extra food travel. So just be aware of that. As far as the Maryland bridge goes, as I said, nice and non-invasive, but kind of weak, tends to fall off. So what's better than that? Well, we come to option number 4, and dental implants. And let's explain to you what a dental implant is. A dental implant is pretty much a titanium screw that is placed into your bone. That is the implant. And on top of that, we place a crown. Of course, a dental implant has the best of both worlds when it comes to dentures and bridges, because a dental implant does not require any cutting of adjacent teeth, so you leave them perfectly intact. But at the same time, unlike a denture, a dental implant is fixed in your mouth. So it does have the advantages of a denture and the advantages of a bridge. Additionally, when you place an implant into that gap, that bone stays where it is. It doesn't shrink like it does with a denture or a bridge, or even worse, when you have nothing there. And in fact, because you are building up the bone when you place an implant, the adjacent teeth actually benefit from the presence of this new implant. They benefit in more than one way. They benefit because, for one thing, the implant is now helping them with the chewing. But additionally, because that implant is in there, the bone is more solid, and so they stay more solid as well. They don't move. Additionally, the gum also stays at a higher position, so the adjacent teeth don't suffer the same kind of gum recession would if you took out a tooth and did nothing, or if you chose a conventional bridge or a denture. What are the downsides of a dental implant? Well, the number one downside, I suppose, is the cost. It does tend to be more expensive than your conventional denture or your conventional bridge. But remember that it lasts a lot longer. So when you think about the longevity of it and all the benefits of it, it may be that the additional cost is worth it. With a denture, it's never going to be ideal. It's always going to be a little bit loose at best. And it potentially can be painful, and of course you can't wait all the time. You've got to take it out every day. You ideally don't want to sleep with it. It usually causes more bone loss as we age. So that's why dentures need replacing eventually. And the new denture doesn't fit as well as the previous denture. That's typical. A conventional bridge is damaging to the teeth that we use to support it. And so we end up losing more teeth as we go along. Eventually we can't keep redoing bridges. A dental implant, on the other hand, is not damaging any of the adjacent teeth. It is acting completely independently of the other teeth. And not only is it not causing bone loss, but it actually builds up the bone. So it is adding extra bony support to the adjacent teeth, which means these adjacent teeth are going to last longer than if you had done nothing. So it is more worth it. Another reason, of course, for the additional cost of implants is it has to be done by people with more skills and knowledge than your average dentist. Additionally, there's a lot of research and development that's gone into developing implants, which is why implant companies charge so much for their products. Of course, you can go to a dentist who uses super cheap implants, but then you just don't get the result, I'm afraid. Another downside of dental implants, of course, is there is a surgical component. Not everybody is very happy about having surgery. But remember that the surgery you have when you place in an implant is not too far off the experience you have when the tooth is being removed. So it's probably not as bad as you think. And if you really feel you can't cope with it, there may be the option of having sedation. Sedation is not usually necessary. In fact, sometimes it's quicker to place the implant than it is to take the tooth out. Is everybody suitable for a dental implant? Well, the answer is no, not everybody is. When we do anything, we have to plan it carefully. When it comes to dental implant, very, very thorough, careful planning is required. And we spend a lot of time on this. We need to look at various things. We need to look at your general health. We need to look at the quality and the quantity of your bone. Now, when it comes to quantity of bone, it's not always a problem because we can always build up your bone. It is surprising how many people I see who would tell me they have been for consultations in the past and they've been told they can't have dental implants. But it is often possible to do dental implants with a bit of bone augmentation. This is a bit more of a complex surgery, and not everybody wants to have it done, and that's fine. But when we plan it, we can tell you how easy or difficult such a procedure would be, if it's possible, if it's a good idea, if it's a bad idea. If we think it's a bad idea, then we will suggest you don't have a dental implant. But the only way to know is to examine you and go from there. It is necessary for us to carry out a proper examination to determine if you are suitable for a dental implant. Now, you can either come and see us in person, or you can give us a call and we could arrange a video consultation. I could have a look as thorough as I can over a camera to see what you're looking for, to see if it's worthwhile for you to actually come in and see me personally. And then we'll need to do a proper examination. Examine your general health, examine your mouth, examine your bone. Ideally, what we need is something called a CT scan. This is a special kind of CT scan that is done in oral surgery, and it helps us to really thoroughly examine your jaws and all the important structures. You may find some dentists who don't do CT scans when they do implants, and frankly, I think that may just be a little reckless. We have our own CT scanner in our practice, and we always do a CT scan whenever we are planning implants. This way we are able to see exactly how much of bone you have available, and also we're able to see where all the important structures are, and then we are able to plan it properly. Without proper planning, we're not going to succeed, and it's really vital that we plan it properly. Remember, we can offer you a video consultation, so why don't you contact us and let's arrange an appointment for a video consultation. The video consultation is completely free of charge. I can have a little look in your mouth while we chat and tell you what options we have available for you, and then we can decide if it's worthwhile for you to actually come and see me in person. And when you do come see me in person, we can then carry out a really thorough examination. You tell me what you want, what you need, and we'll see what we can do for you. You and I can then decide together what is the best way forward for you. So get in touch with us and let's see what we can do for you. Thanks for joining me today.